Hello, my name is Teaka, and today I'm going to be your nurse. We will be conducting a head-to-toe assessment. Throughout the assessment, I may use different instruments such as a pen light, my stethoscopes. I'm going to have to use my hands for palpation. If at any point during this assessment you feel uncomfortable or if you have any concerns, please stop and let me know, okay? We talked briefly and we discussed your past medical history. You do not have any significant history. You are not on any home medications at this point in time. All right, today your temperature was 98.7. Your heart rate was 64. Respirations are 18. We weighed you and today's weight was 250 pounds. You are 71 inches tall. Based on this information, your BMI is 34.9, which is above the average standard of 18.5 to 24.9. Based on this information, you are considered overweight. We can discuss certain modifiers that you can do to get this BMI down, such as a healthier diet, exercise, just making a better effort to make better choices. Okay, there's literature available. There's sites I can refer you to. All right, and so we will discuss that later. All right, so now I'm going to do a assessment of your skin, your hair, and nails. Okay. Before I begin, I will use hand sanitizer to cleanse my hands. Do you have any history of skin cancer, rashes, any kind of infections in your skin, eczema, or anything like that? No? Okay. I'm going to begin with your hair. Is it okay if I remove this scrunchie? All right. Patient's hair is clean. Scalp is somewhat dry, dandruff noted. Hair is distributed evenly throughout. No lesions or sores noted in the head. Head is symmetrical. There's a skin tag noted on above the left shoulder. Have you noticed any changes or in that skin tag or changes in the color? Is it painful? No? All right. Patient's skin is dry. Skin turgor is normal. Patient has tattoos bilaterally. Did you get these tattoos placed in a shop or in a home?
Home.
In a home? Okay, you know you're at risk for hepatitis C and HIV if the equipment wasn't sterile. So if you are going to, with any tattoos, you're going to be put at risk, but it's best to go to a licensed shop. All right? Patient has discoloration on the bilateral wrist. And what is this from?
Waist burns.
Okay. I'm going to examine your wrist. All right. Hair is distributed evenly throughout the legs, bilateral legs. Okay. Patient is clean and groomed. No abnormal amount of perspiration, no body odor noted. Skin color is even throughout. Okay, I'm going to check your nail beds. Nail beds are flat with a pink undertone. They are short and groomed. Capillary refill is less than 2 seconds, and there's no clubbing noted. Okay? Can you smile for me? Open and close your eyes. Okay. Facial features are symmetrical. No facial drooping noted. Eyebrows are in alignment. Can you please stand up so I can check your spine? And have you turn to the side. Okay. Cervical curves and lumbar curves are concave, and the thoracic curve is convex. No abnormalities noted in the spine. Okay, you can have a seat. All right, so I'm going to check your temporal arteries, and I'm going to use palpation first. Temporal arteries are smooth. Any pain or tenderness? No? I'm going to auscultate the temporal arteries using my stethoscope, using the bell side of my stethoscope. Okay? No bruise noted. I'm going to palpate the temporomandibular joints, and there's no swelling, any tenderness. No, I'm going to have you open your mouth. Okay, now close your mouth. There was no crackling heard, any pain or tenderness. Okay. I'm going to palpate your lymph nodes. All right, I'm going to start with the pre-auricular, the post-auricular, the retropharyngeal, the submental, submaxillary, the supraauricular, the deep cervical chain. No lymphadenopathy noted. All right. I'm going to assess your eyes. Okay, just open them. Conjunctiva is pink and moist. Sclera is white. No discoloration noted. Okay. I'm going to have you look straight ahead. You're going to look straight ahead and follow my pen with your eyes. You understand? So, I'm going to have you take this card. You're going to cover your right eye. Okay. So you're going to look at me, and then you're going to tell me when you see this pen, okay? Now you're going to switch sides, switch the card. Okay. Pupils are equal, reactive, and respond to light and accommodation, and confrontation is normal. Okay, now I'm going to check your vision using the smell and eye chart. Okay. If you will, I'm going to have you stand at the front of the bed. You can use this to cover your eye. Okay. You're going to cover your right eye, and you're going to read the lines, each line as I point to it. All right?
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Okay. Based off this chart, in your left eye, you have 20/20 vision. Now you're going to switch eyes. Okay. Again.
E, F, P, T, O, Z, P, D, C, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C.
Okay. So in your right eye, you have 20/20 vision. We are going to check your near vision. Okay. So, okay. Now we are going to do a near vision test. Correct when I say you don't wear glasses or any kind of corrective lenses, contacts. Alright, so you're going to cover your eye and you're going to start with that top line.
E, O, P, Z, T, L, C, D, F, T, D, P, C, F, Z, O, E, L, D, Z, E, L, C, F, O, T, P, F, E, P, C, T, L, O, Z, D.
Okay. Based on this, your score, your vision in that eye is 14 out of 14. Now you're going to cover the other eye.
E, O, P, Z, T, L, C, D, F, T, D, P, C, F, Z, O, E, L, D, Z, E, L, C, F, O, T, P, F, E, P, C, T, L, O, Z, D.
Okay. Based off this chart, your vision in your right eye is 14 out of 14. If you'll have a seat, I'm just going to assess your ears and then check your mouth. Okay. Just cover up. Alright. Okay. I'm going to just assess your ears. Okay. There is no drainage noted in the ear canal bilaterally. Okay. No nodules or lesions. Any tenderness?
No.
No nodules and no tenderness.
No.
All right. I'm going to assess your mouth. I'm going to have you open up. I'm going to use my pen light. You can stick your tongue out. Okay. Tongue is pink and moist. Okay. Buccal mucosa is pink. Okay. Top of mouth is smooth. There's no lesions noted. No cavities. No missing teeth. And no decay. Can you stick your tongue out? Good. No redness in the throat. Any pain swallowing?
No.
Lips are pink and smooth. No cracks or skin is intact. Okay, now I'm going to palpate the maxillary sinuses and the frontal sinuses. Any pain or tenderness?
No. No.
Any pain?
No.
Okay. I'm going to occlude this side of your nose. I'm going to have you breathe in. Okay. Okay. Any trouble breathing in?
No.
Okay. Right nair is patent. Okay. And the left nair is patent. The nairs are symmetrical bilaterally. Okay. There's no lesions or sores noted. Nose is midline and normal shape. Okay, now we're going to do a breast and axilla assessment It is important to do breast exams on yourself because it helps early detection of breast cancer, can save lives. Most men don't know that they should do breast exams because most men think that breast cancer only occurs in females, but that's false. It can actually occur in males, so it's important to check your breast for any lumps or discharge from the nipples. A great way to do this, if you're not, when you're showering, you can check it in the shower. Okay? So I'm going to begin by palpating your breast in a centrifugal manner. Alright, so I'm going to use 3 of my fingers. I'm just going to palpate. Checking for any lumps. Do you have any pain or discomfort?
No.
I'm just going to do a circular motion until I reach the nipple. Okay. I'm going to do the same on the other side. Okay. Have you noticed any discharge from your nipples?
No.
No? Okay. Patient has pseudogynecomastia. No lumps noted. Patient reports no discharge from nipples. Okay? I'm going to have you raise your arm. I'm going to check your axillary for any check your lymph nodes. Okay? And no lymphadenopathy noted. And have you raise your arm. Okay, no lymphadenopathy noted. Now I'm going to have you show me how to check your breast. Alright? So remember, you're going to use 3 fingers and you're just going to palpate in a circular manner. You're going to keep going around and around until you get close to the nipple. Okay, now you're going to do another side. And you're going to be checking for any lumps, abnormalities, anything that's just different from usual. Okay, and be sure to check your nipples for any drainage, unusual tenderness, just anything unusual, okay? And then you're going to raise your arm and just kind of feel under your armpit, there you go, and you're checking for any lumps or kind of nodules, alright? If you find any lumps or, anything abnormal, make sure you let your primary care physician know, okay? Alright, so we're going to do I'm going to do a lung exam. I'm going to use my stethoscope. I'm also going to palpate, okay? Alright. So I'm going to do that. Deep breath. Deep breath. Just going to have you kind of turn to the side a little bit. You can stay calm. Deep breath. lung fields are clear, and that's anterior, posterior, and lateral lung fields. Chest symmetry is symmetrical bilaterally. Respirations, we said earlier, were 18. Patients' respirations are regular, even, non-labored. Okay. They are, like I said, his lung fields are clear upon inspiration and expiration. All right. Now I'm going to assess you using my stethoscope. I'm going to listen to your heart. Okay, I'm going to check your carotids, checking for any kind of edema or swelling. Okay. Okay, no murmurs or arrhythmias noted. All right, I'm going to check your carotids. Okay, I'm going to auscultate your carotids bilaterally with my listening with my diaphragm and the bell of my stethoscope. All right, carotids are bilaterally 2+. All right. Now I'm going to listen with my bell. All right. I'm going to check your brachial pulses. Okay, brachial pulses are bilateral, 1+ bilaterally. I'm going to check your radial pulses. Okay, radial pulses are 2+ bilaterally. I'm going to check your popliteal pulses behind your knee. I'm going to raise this a little bit. Okay, popliteal pulses are palpable, and they are palpable bilaterally 2+. All right. I'm going to check your posterior tibial pulses. Okay. The posterior tibial pulses are 2+, and now I'm going to check your pedal pulses. Bilateral pedal pulses are 2+. All right, as we stated earlier, capillary refill is less than 2 seconds. And earlier, before we started, we discussed we were discussing your health history, and I asked you your name and date of birth. Can you please repeat that?
Jonathan Green, 10/15/84.
Okay. And do you know where you are?
Yes.
Where are you?
Getting a checkup.
Okay. And all right. Based on that information, patient is able to follow commands, answer appropriately. Patient is alert and oriented to time and place and situation, and his Black Scale Coma scale is 15. Okay, earlier when I was assessing your auscultating your heart sounds, I was able to hear S1 and S2. There were no murmurs or extra sounds noted. Also, when I was auscultating your carotid arteries, there were no bruits noted bilaterally. I'm going to have you turn your head to the right a little bit. Okay. There's no jugular vein distension. Okay. No jugular vein distension. So there's no jugular vein distension noted bilaterally. I'm going to have you lay back and I'm going to check you for edema. All right. No edema noted. Sit up. All right. Now we're going to begin our assessment on the cranial nerves. Cranial nerve 1 is the olfactory nerve, and to test this, I'm going to test your smell. I'm going to have you close your eyes, and then you're going to take your index finger and include your right nair with it, and I'm going to place something by your nose, and you're going to tell me what it is, what the smell is, okay? What is it?
Garlic.
Okay. Now you're going to switch. Keep your eyes closed and switch sides. Yes. Okay. Patient was able to smell both smells bilaterally. The cranial nerve 2 is the optic nerve. We tested this earlier with the smell and eye chart and the near vision test. Smell and eye chart patient had a score of 20 out of 20, and for the near vision test it was 14 out of 14. For cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens nerves, we also tested this earlier with the 6 cardinal points of gaze, which was normal. Eye movement was normal. There was no nystagmus noted. Okay. The cranial nerve 5, which is the trigeminal nerve, we are going to do the cotton whisk test. Okay, this is a piece of cotton. This is what it feels like. I'm going to have you close your eyes, and when you feel the cotton, you're going to say now. Okay?
Now. 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 Now.
Okay, you can open your eyes. The patient was able to feel the cotton, no sensory loss. We're going to check your corneal reflex. Keep your eyes open. Okay, corneal reflex is intact. All right, cranial nerve 7 is the facial nerve. We're going to check motor activity. I'm going to have you close your eyes and open them. Show me your teeth. All right, frown. All right, puff out your cheeks. Okay. There's no muscle weakness noted. Facial features are symmetrical. Raise your eyebrows. All right. Okay. There's no weakness noted. For cranial nerve 8 is the acoustic nerve. We're going to do the whisper voice test. I'm going to have you clench your ear canal with your index finger, and you're going to place it against your tragus, which is right here. Okay? And I'm going to stand behind you. I'm going to whisper 2 words. and you're going to repeat it once you hear it. If you hear it, okay?
Red Bull.
Okay. Now you're going to do the same on the other side.
Brown dog.
Okay. You can relax. All right. Patient was able to hear both whispered words bilaterally. Okay. So for cranial nerve 11, which is the accessory nerve, I'm going to test your trapezius muscles. You're going to raise your shoulders. Okay, come down. Raise it again. All right, you can relax. Shoulder muscles were symmetrical. We're going to test the sternocleidomastoid muscles, and you're going to take your head and you're going to put your right ear against your shoulder without lifting your shoulder. Now you're going to do the same with your left ear to your shoulder. All right, you can relax. Now I want you to look to your right. Okay, look to your left. All right, now you look ahead, put your head back to the front. Okay, and relax. Range of motion in the neck was normal, and also with the sternocleidomastoid muscles. Okay. We're going to test cranial nerve number 12, which is the hypoglossal nerve. For this, we're going to test tongue strength. I'm going to have you stick your tongue out, put it back in. All right, stick it out. You're going to move it to the right, to the left. Okay, you're going to put it in, and you're going to place your tongue against the right side of your cheek. I'm going to press, and you're just going to push against it. Okay, then the other side. All right, so tongue strength is normal. Okay, now we're going to test your muscle tone. I'm going to have you squeeze my fingers. All right. Okay. Bilateral hand grips are normal. I'm going to have you stick out your arms. I'm going to apply some pressure. You're going to push against me. All right. And keep your arms up. You're going to do the same. Okay. Bilateral muscle strength is normal in the arms. Bilaterally, I'm going to have you lay back. And I'm going to have to test your pedal strength. Now I'm going to place my hands on top of your feet. Okay, I'm going to apply pressure and I'm going to pull back. Pull back. Okay? Now you're going to push against my hand. Okay? Now strength is equal bilaterally. You can sit up. Okay. Now we're going to, you're going to place the tip of your finger against my finger and touch my finger. And now you're going to touch your nose and touch my finger. Keep going. Okay. Keep it up. You're going to do the same with the other finger. Alright, coordination is equal bilaterally. You're going to stand up and we're going to do heel to toe. We're going to walk heel to toe. And I'm just going to demonstrate. You're just going to take your heel and place it in front of your toe. I'm just going to do like this. Okay. Alright. Patient was successful, and earlier I had to stand up, and when we did your eye test, I noticed that your gait was normal. Okay, we're going to do the rapidly alternated movements. You're going to put your hands like that, and then you're just going to go like this as fast as you can. Okay, you're going to have to stand up. Stand up. We're going to do the Romberg test. For this test, you're going to close your eyes, keep your arms at the side, put your feet together. Alright, Romberg test is normal. There's no swaying noted. Okay, you can open your eyes. Alright, you can have a seat. Now we're going to test for the coronary drift. For this test, you're going to put your arms out in front of you, palms up, and close your eyes. Alright, the hands are not turning in, coronary drift is negative. Okay, you can open your eyes. So now we're going to test for stereogenesis. You're going to close your eyes, you're going to open your palm, I'm going to play something in your palm, and you're going to tell me what it is, okay?
Colon.
Can you play something in your body now?
Q-tip.
Open your eyes. Patient was able to identify both objects and each palm bilaterally, so stereogenesis is normal. We're going to assess the graphesthesia. For this, I'm going to have you open your palms again, and I'm going to describe something in your hand, and you're just going to tell me what it is. It could be a shape, a letter, or a number. Okay? So you're going to close your eyes.
Number 3. Number 4.
Alright. Open your eyes. Graphesthesia was normal. Patient was able to identify both numbers. Alright. So now we're going to test your reflexes. And we're going to start with the bicep reflex. Alright. Flexion was noted bilaterally. Okay. Now we're going to test the tricep reflex. Select your arm. Okay. Extension was noted, tricep reflex bilaterally. Now we're going to test the patellar reflexes. Okay. You might have to scoot up a little bit. Have your feet hang, just relax. Alright, and extension was noted bilaterally. Now I'm going to have you lie back, and I'm going to check your abdomen. I'm going to palpate. You tell me if there's any tenderness. Any tenderness? Okay. Abdomen is rounded. No distension noted. It's soft to touch. Okay. I'm going to auscultate vowel sounds in all 4 quadrants. Okay. Vowel sounds are active in all 4 quadrants. Now I'm going to auscultate for vascular sounds using the bell of my stethoscope. I'm going to start with the aortic sounds. Okay. Renal arteries. Iliac artery. And the femoral artery. Okay. No bruits or friction rubs noted.